Welcome back to UK Pension Guide. For generations, free NHS prescriptions have been one of the most valued perks for people over 65 across the UK. This benefit has allowed millions of older adults and retirees to access essential medications without worrying about the cost. However, a significant shift is set to occur in October 2025, potentially transforming the system as we know it. The government has confirmed new eligibility rules that may strip free prescriptions from thousands of people over 65, particularly those not yet receiving the state pension or specific benefits. This change, framed as part of broader health system reforms, has triggered a wave of concern among pensioners, charities, and medical professionals. Many fear it will place additional financial pressure on vulnerable older adults, especially those with limited income. In this video, we'll explain what's changing, who will lose access to free prescriptions, and what you can do to secure your entitlement before the new rules come into effect. Since 1974, all UK residents aged 60 and above have qualified for free NHS prescriptions, regardless of income or employment status. This policy was designed to help older adults manage rising healthcare costs after retirement when incomes often dropped. It was a system based on fairness and accessibility, supporting millions of pensioners who rely on medication for conditions like heart disease, diabetes, arthritis, and more. Currently, over 12 million people in England benefit from this rule. The government now argues that maintaining this system is becoming unsustainable due to growing NHS expenses and increasing life expectancy. This has prompted a rethink of how prescription entitlements are structured. The Department of Health and Social Care has announced that the free prescription age will be raised to match the state pension age, currently 65 to 66, and expected to increase further in the future. In practical terms, this means only those who are 66 or older or already receiving the state pension will automatically be eligible for free prescriptions. People aged 60 to 65 who haven't started claiming their state pension will need to pay for prescriptions currently priced at £9.90 per item. The rollout begins on October 6, 2025, and will gradually affect millions of people aged 60 to 65 across England. Not all over 60s will automatically qualify anymore. The most affected groups include individuals aged 60 to 65 who are still working and not yet receiving the state pension, early retirees who haven't reached state pension age, and older adults with modest incomes who don't claim means-tested benefits. For many, this could mean paying for multiple prescriptions each month, quickly adding up to hundreds of pounds annually. For example, someone needing 4 prescription items monthly would face nearly £480 per year, a considerable burden for anyone on a fixed income. Certain groups will still qualify even after October 2025, including people aged 66 or older at the state pension age, those receiving pension credit guarantee or savings credit, individuals with long-term conditions covered by the NHS Medical Exemption Certificate, and low-income claimants with NHS tax credit or HC2 certificates. Residents in Scotland, Wales, and Northern Ireland will remain unaffected as prescriptions are free for everyone in those regions. This reform only applies to England. The financial consequences could be severe. Older adults managing long-term health conditions may have to make difficult choices between essentials like food, bills, and medicine. Around half of all over 60s in England take at least 3 regular prescriptions. Research already indicates that 1 in 10 pensioners skips medications due to cost. Charities warn this could result in more hospital admissions and worsening health outcomes, while the government frames this as fairness for those still working. Critics call it a hidden tax on ageing, placing undue financial strain on retirees. The transition will occur in stages. In October 2025, the legislation comes into effect in England. By November 2025, the NHS will start sending updated eligibility letters. In January 2026, pharmacies will begin enforcing proof of entitlement, and by April 2026, penalties for false claims will rise to $120 per offence. This phased rollout gives pensioners a short window to update benefits, apply for support certificates, and prepare before being removed from the free prescription list. If you're aged 60 to 65, there are steps to avoid unnecessary costs. Apply for pension credit, as even modest entitlements can maintain NHS benefits. Use the NHS low-income scheme to potentially receive full or partial help. Claim a medical exemption certificate if you have conditions like diabetes, epilepsy, or cancer, and check your state pension age via the official government calculator to plan ahead. Acting before October is crucial to prevent automatic removal from the free prescription system. Government officials state that the change could save the NHS around $250 million annually, which they say will be reinvested in frontline services. Yet analysts warn these savings could be offset by higher healthcare costs over time. Fewer pensioners taking medication could result in increased GP visits and hospital admissions. The change may also widen disparities between England and the devolved nations. Critics see it as part of a trend to reduce age-based benefits, with potentially far-reaching effects on health and well-being. From January 2026 onwards, NHS systems and pharmacies will verify eligibility in real time. Anyone claiming free prescriptions without entitlement could face a $120 penalty per false claim, a requirement to repay prescription costs, and possible benefit fraud investigations. Enhanced data sharing systems between the NHS and DWP will make false claims harder to conceal. The public response has been immediate and strong. Organisations like Age UK and the Patients Association are campaigning for a reversal. Protests are being planned outside Parliament and NHS offices, and petitions have already collected over 600,000 signatures. MPs from multiple parties have raised concerns about the disproportionate impact on low-income pensioners. For many, this debate is about more than money. It's about fairness, dignity, and trust in a system intended to support those who have contributed for decades. The end of universal free NHS prescriptions for over-65s represents a historic shift in UK healthcare policy. What was once a guaranteed benefit is now tied to state pension age and income criteria. While the government claims this reform ensures fairness, many older adults see it as a growing burden. If you're nearing 60 or already retired, don't wait. Check your eligibility, apply for all available support, and ensure your NHS records are up to date. Staying informed and proactive is key to safeguarding both your health and finances. If you found this update useful, subscribe to UK Pension Guide for thorough breakdowns of DWP, NHS, and pension changes. Hit the bell icon to stay informed on major policy updates that may impact you and your loved ones.